Well, we will get started now. Hello. For those that are here live, welcome. I'm glad you're spending your time here with me today. I'm going to make it worth your while. Same for all the people on Zoom today. This is going to be a talk about reversing diabetes naturally and how to become clinically non-diabetic. And so I'll explain all of that to you today and give you some alternatives to maybe what you're doing now. And also, if you apply some of the things that I talk about today, it really could change your health overall and change your life, quite frankly. So it's an important time that we're going to be together, and I'm going to make it worth your while. So today you're going to learn about some successful natural treatment plans for improving and preventing prediabetes for those of you that have that, or if you are diagnosed with diabetes. It's going to include talking about monitoring and support that can be helpful. We're going to talk about a personalized diet plan and supplements and exercise, and working in conjunction with your physician if you are on some medication for diabetes already. Physician supervised weight loss is part of the plan too, because weight loss is also very, very important for anybody who's pre-diabetic or diabetic. And stress management is another component of what I do to help people become clinically non-diabetic, and limiting your need for medication. So if those are things that you're interested in, you're in the right place. Okay. I'm going to tell you a little bit about myself. I'm a certified member of the Foundation for Wellness Professionals, a diplomat in Occupational Health Care. I've been the clinical director of Advanced Wellness and Injury Center since 1979. I have over 40 years in clinical practice, treating over 15,000 patients, and frequently consult many corporations on ergonomics, wellness, and prevention and treatment of work-related injuries. I lecture on the topics of optimal wellness, stress management, natural solutions to type 2 diabetes, which is the topic for today, male and female hormonal problems, sports and work injury, treatment and prevention, and holistic health care. I've been a member of the Spinal Surgery Committee at Danbury Hospital, and I've completed a postgraduate program leading to a certification as a Functional Medicine Practitioner. I'll tell you a little bit about what that means, and a diplomat degree by the American Board of Clinical Nutrition. I have certification in Oriental Medicine and Acupuncture, and I do that personally also. And I'm currently enrolled in a diplomat program by the American Board of Clinical Nutrition. That's enough about me. And okay, I have an associate that works with me. Her name is Dr. Rockenow. She is board certified in family medicine, completed her medical residency at Columbia University, and we work together to help patients find natural solutions to their health problems. I want to read you our mission statement. It's the mission statement of my office, and it's been something that we've rarely had in place for over 25 to 30 years, maybe even 30 years. I'm not exactly sure, but we haven't changed a word of it. We really thought about every single word that we put in our mission statement, and we've been able to stick to that since we've been in practice. So we're a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and my community also. That's part of the reason why I'm here today, is to educate the community also on how to sustain a lifetime of optimal health and wellness while limiting your need for drugs and surgery. So that's my purpose. That's my passion. That's what I've been doing for over 40 years, and you're going to learn a little bit about it today. I always ask anybody that I talk to, what are the most important single words or words in that statement to you? And anybody who gives me an answer gets a prize. So I say, and there's no wrong answers. So I'd love some answers from you. What's most important to you in that mission statement? Well, I'm glad you picked that one. So I'm going to give you a little prize. It's a card that helps you measure how stressed you are. Okay. Okay, well, lifetime. Lifetime's a good one too. Okay, you don't want to do it just for a little while. You want to do it for a lifetime, right? Get one of our cards also. Multidisciplinary? Good. Okay. Well, thank you for giving me some answers. So let's start with talking about limiting your need for drugs and surgery, okay? I'm going to give you an idea about that and some ideas about that. So there are many ways to fix the same health problem, quite frankly. Medication and surgery are two of those ways, but there are alternatives to that. That's what I'm an expert at. I have a functional medicine degree, which means I help the body work better, be healthier, so that you don't have the need for drugs and surgery. Doesn't mean that they're not necessary. We don't eliminate them, but we limit your need for them. And I never take anybody off of medication that they've been on by their doctor. It's something that you and your personal physician, whoever recommended those medications or surgery, it's a decision, a joint decision. But I want you to limit your need for it. That's the ideal thing, in my opinion. And it should go on for a lifetime. If you do the right things, our bodies were designed to be healthy. And so if you do the wrong things, our bodies really tell us that we're not doing the right thing. And so I'm going to talk a little bit about that philosophy of when you know when you're doing the right thing and when you're doing the wrong thing. So I think we can go on from this slide. Okay, what we'll cover today is what is diabetes, what is something called metabolic syndrome, how to prevent, control, and eliminate type 2 diabetes, limiting your need for medications and why, complications associated with type 2 diabetes, diabetes statistics, healthy eating for life nutritional program, which is part of the way I help people naturally really decrease their need for medication, and stress, which is really something that everybody is subject to. Is anybody here who has no stress in their life? I usually don't get anybody raising their hands to that. So stress is all around us, and it's different today than it was years ago, quite frankly, for a number of reasons. One is we have constant communication that we didn't have before. Some of that can be very stressful. For some people, going to the mailbox and looking at their bills is very stressful. So they're all forms of stress. We'll talk a little bit about that, and I'll give you some possible ways to decrease the harmful effects of stress. They want to come to the class. But I can't get rid of your stress. I can't get rid of your husbands, your wives, your kids, your bills, any of that. But I've helped thousands of people decrease the harmful effects of stress. So don't think stress is unavoidable and you can't do anything about it. There are things that you can do to balance how stress affects you. That's very important. I want you to start thinking about that you have control over your health. That's really part of what I educate patients about too. And lots of people don't think they have control over how to really improve their health, but you really do with the right information. Okay, so the Centers for Disease Control and Prevention calls diabetes the epidemic of our time. It really is an epidemic. It's something that has really tremendously increased in our country, in spite of what we've tried to do to help it, with medication, surgery, and all sorts of health possibilities. We still haven't changed the epidemic of diabetes. As a matter of fact, it's getting worse. And it's affecting our children now. I don't know if you know that, but diabetes used to be called adult onset diabetes. Did you ever hear that term? Anybody? But it used to be called that. It's not called that anymore. It's called type 2 diabetes. Do you know why it's not called adult onset diabetes anymore? Because kids are getting it. Yeah, teenagers are getting diabetes much earlier than ever before. And it's not because they're different. It's because what we're doing to ourselves is different. Think about that. That's the real cause. The difference between a functional medicine doctor and a traditional doctor is I think about not just what you have, but why you have it. Why? Big difference. One person can be diabetic for one reason, another one can be diabetic for another reason. And all of our health conditions can be different by why you have it. So the name of the condition is not most important, but why you have it and what we can do about that is really important. So here's some facts regarding diabetes. Diabetes doubles the risk of stroke and heart attack. Diabetes is the #1 cause of blindness in adults. Complications of diabetes kills more people than breast cancer and AIDS combined. 1 in 13 people now have diabetes. 1 in 4 don't know it yet, and 1 in 5 are at risk of getting diabetes. So as I said, it's an epidemic, but I believe it's very, very preventable, reversible in many, many cases. The hidden secrets of diabetes. Again, the #1 cause of blindness, the #1 cause of kidney failure, the #1 cause of amputation. Diabetic medications do not prevent complications from happening. That's what you should realize also if you're on a diabetic medication already. You can reverse type 2 diabetes naturally and get off of your medications. Pharmaceutical companies have no incentive to get you better off of your medication. Understand that statement? The reason is because medications are designed, for the most part, to manage your condition, not to cure it, not to get rid of it, because the company makes money as long as you are on the medication. They don't want to really cure the condition. They want to manage it. A total of 117 million people are affected by diabetes, 50% of the population. Diabetes shortens your lifespan by 5 years. 4.2 million people have diabetic retinopathy. That's eye damage because of diabetes. Diabetics are 4 times as likely to get dementia. We're even calling dementia type 3 diabetes now. That's how connected it is. So if you want to prevent future deterioration of your brain, I'm telling you how to do it today, or at least giving you an opportunity to find out how to do it by also helping with diabetes. And neuropathy can be reversed. Even people who have neuropathy already due to diabetes, that can be reversed also. Okay, unfortunately, type 2 diabetes is becoming an epidemic with 1 out of 3 children born today expected to become diabetic. Type 2 diabetes used to be called adult onset diabetes. Told you that already. All forms of diabetes are caused by the fact that sugar in the blood fails to make it into your cells. Cells are the building blocks of our body. And you get high blood sugar. And when it gets high enough, we call it diabetes. If it's not high enough yet, we might call it prediabetes. And you really want to do something about preventing this even before you get prediabetes. Ideally, you want to prevent that from ever happening. If you have it already, there's things that can be done to prevent it from becoming diabetes. And even if you are a diabetic, we can do some things to help you try to reverse it naturally. If you're overweight, have high cholesterol and high blood pressure, without elevated blood sugar, you have something called metabolic syndrome. And if it's not addressed, it will eventually lead to diabetes. Any of you have high cholesterol? Please raise your hand. Pretty common problem. Any of you have high blood pressure? Okay. And so any of you overweight? Okay. So these are the things that are the risk factors for getting diabetes, and there's something called metabolic syndrome. I don't believe in waiting until you become a diabetic. I believe in helping people really prevent that from happening. So many people even put together a book for my patients called Natural Solutions to Diabetes. I've seen so many patients and helped so many patients with this problem. Today we'll go over what causes these problems and the solutions. Since type 2 diabetes and metabolic syndrome are not genetic, lots of people are told that the real cause of their problems is their parents had it. These are not necessarily genetic problems. They have much more to do with your lifestyle, with what you're doing to yourself. And so if somebody could teach you, could do to yourself that will prevent this, it doesn't sound like a good idea. I mean, if it doesn't make sense to you, I'll stop. But if it makes sense to you, and these are things that you're not taught by your traditional doctor. He really wants to manage your problem, not reverse it, get rid of it, teach you the cause of why you have it. You can prevent, control, and eliminate these things. So I want to change your attitude about your health and about what you can do about it. By lifestyle, what we mean is what you eat, or taking the appropriate supplements, appropriate exercise, getting closer to ideal weight, managing your physical, mental, chemical stress, sleep optimally, and in general, Learn how to take care of your body. We all should be taught this when we're kids. Should be taught this not now, but when we were children, and it hasn't happened. And so I'm of the organization called the Foundation for Wellness Professionals. Our passion is to teach people about this, whatever age they are, as early as possible, as late as possible. But it's always a good time to learn these things and to start doing something about them, to learning that you can do something about preventing illness. If you're here today and you don't have diabetes, we want to help you eliminate some of your other health problems. I saw some of your health and stress surveys, and lots of you have many, many problems. So I'm going to talk about what that means also, that you've got checked off so many things. Okay, so this is the survey that you filled out. How many people checked off one thing on that survey? Just raise your hand. At least one. At least one. Okay. Okay. At least two. Anyway. Okay. At least three. Okay. So I want to point out to you with this survey that these things are common, but that doesn't mean that they're normal. You understand the difference between common and normal? Normal means you don't have them. Common means lots of people have them. So our health in our country is not ideal. We spend more money than any other country on our health care. You know that. Probably most of you know that already. Healthcare is expensive in this country, and it really isn't solving the problems that we have. And it's not because doctors don't care. Doctors care. They want to do the right thing. But I think the approach is wrong. Again, not getting rid of the cause is part of the problem. Instead of just covering it up with maybe some of the medications that you might be on, you're covering up problems instead of getting rid of the cause. Does that make sense to you? Not getting rid of the cause. Well, let me give you an example. Anybody here have headaches, let's say, as a routine? Anybody have pain somewhere? Yes? Okay. If you have pain, what do you do? What do you do when you get pain? Take Tylenol. So I want to ask you, do you think that your pain is because you have a deficiency of Tylenol in your system? Do you think you have pain but you don't have enough Tylenol in your bloodstream, and that's the reason you have pain? Do you think that's the reason? Anybody? Most people realize that that's not the reason. There's other reasons for the pain, many, many other reasons. So taking something that covers up the pain temporarily, if you take Tylenol, does it give you any chance of having pain less in the next week or the next month or the next? No, it doesn't fix the cause of the problem. My purpose and my practice is all about fixing causes, not covering them up. Okay, it's never normal to have a symptom. That's what all those things on that stress survey, on that survey is all about. There are different complaints and symptoms, things that you feel. It's never normal. Have a symptom. What a symptom is your body's way of trying to tell you something's wrong. Something's wrong. Okay? And it's not, and it needs to be addressed and checked, and ideally get rid of the cause. Okay. So think about your car. Most people take care of their car pretty well. Would you check your car if the engine light went on? Yes, most people would. Okay, symptoms are a warning that something's wrong. There's no such thing as a normal symptom. You would check your car to make sure it didn't get worse. Your body deserves the same attention instead of just covering it up. So if you have more than one symptom, if so, let me tell you what that means. If you have more than one symptom, or the one symptom you have occurs more than once per week, you have a situation you should do something about. Find out why. Don't just keep covering it up and having to take the same solution, same cover-up medication over and over and over again. Okay, today you have a couple of choices regarding your health. You can do the same things that you're doing. You can kind of leave here today, keep doing the same things, and get the same results. If you keep doing the same things, there's something called the definition of insanity. If you keep doing the same thing over and over again, and you think you're going to get a different result, there's something wrong. You're not thinking correctly. So you have to do something different to get a different result. So I really think that today is an opportunity to say, boy, I've been doing this. This is my result. I'm getting all of these symptoms. maybe I could do something different. Maybe somebody hasn't taught me another way to get rid of these problems and really have um, less need for medication and surgery and feel better overall. This is also about feeling better. This is not just about covering up stuff. This is about making yourself healthier, living a better life for the rest of your life. So the choice is up to you. Again, you can let all the information I give you here go in one ear and out the other ear, or you can let it get stuck in the middle here and do something about it. I'm going to give you an opportunity to do something about it too. If I could show you today how to get rid of your problems by doing something natural and affordable, would you do it? Okay, raise your hand if you would do it. You would do something natural and affordable. There's nothing to hurt. Raising your hand didn't hurt, did it? So I say, I just want you to be open-minded enough to think about doing something different. Well, let's look closer at something called insulin resistance. The reason your cells would resist insulin lies in the fact that if you're similar to the average American, you consume 150 pounds of sugar a year. Isn't that unbelievable? 150 pounds a year is the average. And it's not just in the sugar that you add to things, it's the sugar that's in things, and it's the sugar that things turn into some of the foods that you eat on a regular basis. Up until 300 years ago, the only way to consume sugar was by chewing some sugar cane. That's not the case nowadays. So what we see here in this graph is that our sugar intake about 300 years ago was less than half a pound per year. Now it's half a pound a day. Do you think that has any effect on your health? How many people say yes? I want to hear how could it not? How could half a pound a day of sugar in your foods and sugar that you add to food not have some effect when we used to have less than half a pound a year? That's the difference in what we eat today between what we used to eat. And that's part of the reason that we have epidemics of certain health problems. A very big part of the reason. Food is a major part of the reason. Okay. As you easily can see, we now consume more than sugar in one day than what our ancestors did in a year. Think about that fact. Okay, it's not your fault. Okay, I'm not blaming you. Okay, don't blame yourself. We are biologically addicted to sugar and food that causes spikes in our blood sugar, like wheat, rice, starchy vegetables. Those turn into sugar. Most people don't know that. And so you have to identify all of the things in your diet that turn into sugar that are causing part of these health problems. We're constantly being bombarded by marketing and misinformation to lead us to eat unhealthy foods. Don't believe what you hear on television. Don't believe what you see on the fronts of packages telling you that they're healthy. You need an expert to explain to you the difference between healthy and unhealthy. I have so many patients that come into my office and I say, I'm going to teach you what healthy eating is. I call it healthy eating for life. And so it's a program that I designed. It's called How to Eat Healthy for Life, to stay healthy, basically. And I can't even think of how many people know what it is to eat healthy. It's really not what you're taught. And there's so much misinformation out there. You need somebody who's going to give you the truth and show you results because you start to follow the truth. Brain imaging shows that the addiction center, the same one that lights up with cocaine or heroin, is lit up by sugar. So again, it's not your fault. Part of it is an addiction that the food industry has built into foods. Sugar should be treated as a recreational drug. It's not something that you should be having every day. It's a recreational drug, occasional. Food can be your best friend or your worst enemy. So we look at some people here who are eating fruits, vegetables, real foods, I call them. And then we got a pizza and beer party here. Do they look healthy? Do they look happy? No. Food affects you. Food is medicine, and it can be used as good medicine or bad medicine. Pharmaceutical industry doesn't create cures. They create customers. I'm telling you the truth from treating so many patients who work in the pharmaceutical industry, from having pharmacists in my audience and telling me, Doc, you know how many drugs I take? And this was a pharmacist who was in practice for 25 years. You know how many medications I take? 0. Because they know more about medications than you do, than I do, than the doctor who prescribed them. And they know the dangers of those medications, you know, the limitations of those medications, and they try to avoid them. They take much less medication than the average American. Pharmacists, think about that. Why don't they do it? Because they know that it's not really the answer. Why not Ozempic? You know, this is the big craze nowadays. Has anybody tried that at all? Okay. It's not a good idea. It's, again, an alternative to doing the right thing, which is really eating healthy. It's not to be utilized for short-term weight loss. You won't learn healthy eating and the cause of your weight problem. Side effects are kidney problems, GI problems, long-term problems still unknown. Cost was astronomical. It's been lowered, but that doesn't matter. It's not the right way to solve your problem. The FDA approved it only for type 2 diabetes, not for weight loss. It will not reverse or reduce health problems that healthy eating life will reverse. It's just a marketing shortcut. You're being told that this is another alternative. It's not a good alternative. To help eliminate high blood sugar or any health problems you have, you need to look at what's causing these. The first thing that leads to this problem is too much sugar. Our blood sugar support product, it's one thing that I use in my office, is designed to help you reduce your craving for sugar, help you recover from the harmful effects of sugar. It's just one part of a program that I have. So I'd say it's something that can be done to help you, and it's really, really designed to help people who are pre-diabetic or have diabetes. But it's only a piece of the puzzle. Finally, you need to address what stress does to your hormones and blood sugar. The adrenal glands are considered to be the stress gland. Have you ever heard of the adrenal gland? You've heard of adrenaline. It's where it comes from. And the gland has to pump out adrenaline and other hormones like cortisol every time you're under some stress. And that has a lot to do with your blood temperature. So to ignore whether you're under stress or not means also to ignore part of the puzzle helping you. Adrenal hormone cortisol controls blood sugar by breaking down fat to keep sugar in your blood at the proper level. Part of my program is also to do some testing that you may not have had. It's included in the program, usually covered by insurance. Testing is, and so I would say it's something that really, really, even though you've been to your doctor and you've gotten blood tests on a regular basis, sometimes not all the tests are being done by the traditional doctor, and they need to be by somebody who looks at things a little different. If this hormone's out of balance, you'll gain weight, you'll be tired, you'll have problems sleeping. Any of you have sleeping problems? Very common also, all related. And so I would say when you do the right things, you can help yourself with that too, and your energy also. Okay. The function of this gland can be measured. We do it the first thing somebody comes into our office for the first time. We actually do a test in the office, not a invasive test. It's really to see if your body is being overstressed. Some of your problems may be caused by stress. Stress in the adrenal glands is considered a cause or a contributing factor in 80% of many health problems that bring a patient to the doctor. So these problems include fatigue, insomnia, digestive trouble, women's hormone problems, high blood pressure, heart disease, allergies, and inflammatory problems. So if you keep ignoring the stress, or you just take something to cover it up, like an antidepressant or an anti-anxiety pill, addressing the cause, and again, you're going to have lots of these other problems still bothering you. Any program to improve health or address diabetes must begin by checking the adrenal. The fourth contributing factor to type 2 diabetes, as well as a variety of other problems, is being overweight. So carrying around extra weight is really one reason that we are also predisposed to diabetes and lots of other diseases. It's unhealthy. And so I'm not saying that I can get rid of everybody's fat cells, but we can reduce them. Reducing them is also very, very healthy. So we'll talk about that. Our unique and dramatically effective approach to weight loss, called Healthy Eating for Life, which leads to you improving your overall health and feeling great and losing weight, all combined. It's not just about losing weight, but it's also about feeling great too. So this system of weight loss is dramatic because it works so quickly. You can pay careful attention if you'd like to finally lose weight, lower your blood pressure, reduce your cholesterol, improve your energy. All of these things are helped by just reducing weight. Healthy Eating for Life addresses the fact that each week we're potentially exposed to 82,000 chemicals. Isn't that unbelievable? That's how many chemicals are in our environment, in our foods, and in our cosmetics. If you can't eliminate all those chemicals, they'll enter your bloodstream in the form of something called free radicals. And what your body does to stop free radicals from hurting you is the body will manufacture fat and surround your cells with fat in order to protect the cell from damage from all of these chemicals. So reducing the amount of fat in your body reduces the harmful effect of the chemicals. Anybody have a question about that? We all are being exposed to these chemicals and we don't know how much they're harming us, but reducing the amount of fat in your body is really, really one way to really make yourself healthier right away. Okay. To stop cell destruction, the body will manufacture fat. The result, we'll just go on. Healthy Eating for Life program is designed to lead to rapid weight loss and improved health, including preventing and controlling type 2 diabetes while limiting your need for medication with doctor supervision. This program should only be done with the advice of a healthcare professional like myself. Here are a few before and after pictures. Most of these are people obtain dramatic results in the first 3 days of eating correctly. Before a 9-day cycle, this is what this person looked like. After the first 9-day cycle, he lost 15 pounds, and his waist size went down 2 inches, and I was starting to feel better, look better. After the second 9-day cycle, his weight was down a total of 31 pounds, and he lost another 5 inches of his waist. Before, I had a patient who had weighed 276 pounds, and afterwards was down to 155, overall lost 121 pounds. But I want to show you what weight does, and how it causes so many problems. So the disease risks from extra weight is high blood pressure, diabetes, heart disease, something called PCOS, gout, arthritis, erectile dysfunction, cancer, and high cholesterol. All of those things is related to high weight. All of those things related to excess weight. So why treat each one of those diseases individually when you can really, really improve all of them by decreasing weight? The next factor improving your health is mild, appropriate exercise. We're not going to turn you into marathon runners. Anybody want to be a marathon runner here? No, but some exercise for everybody is really important. And it has to be customized for you. It can't be just the same exercise for even just for the 4 of you here. I personally recommend certain exercises for certain people, something that's going to be beneficial. You'll feel better. You won't hurt yourself. I'm an expert at that also, is how to give you exercise that aren't going to hurt you, but are going to help you. So you already know that it would be healthier if you were to exercise. One of the reasons that people don't exercise is due to pain. Anybody here who stops from exercising because of pain? Maybe not. So that's one reason. There are there's some people here who said that. Yeah, it's a common cause. And so the name of my office is Advanced Wellness and Injury Center. Half of my practice is about wellness. Half of my practice is about helping people who are injured or hurting. So we know that there are lots of ways to help people naturally as far as pain is concerned. One of them is acupuncture. I do acupuncture with and without needles. One of the ways that I do it mostly is with electricity, a little tiny electrical current that can help acupuncture circuits help your body decrease pain. Oops. So pain. These are common things that by the age of 13, the average person commonly has 1,000 traumas from falls, accidents, sports injuries, and it can cause damage to your musculoskeletal system and to your nerves. And these are things that lots of people just live with. And then they have to medicate themselves their whole lives because nobody got rid of the cause. Diabetics can develop severe pain and numbness in their legs from diabetic neuropathy. Anybody been told that they have diabetic neuropathy? Anybody here? No? So nerves are very sensitive. These cells are, we'll go on. So symptoms of diabetic, anybody have any of these symptoms? Numbness, burning pain, cramping, sharp jolting pain, prickling, tingling, discomfort when you walk, can't go to sleep or awaken because of restless legs. Anybody have any of those things? Yes, no? Okay. Some people do commonly, especially associated with any diabetes. But lots of people, it hasn't happened yet, but unfortunately, it's very, very common. In our clinic, we've been able to help people with diabetic neuropathy and other nerve-related problems by not only providing the essential nutrients the cells need, but also by providing increased circulation to the nerves. It takes a combination approach. So it's not where everybody's the same and everybody needs an individualized approach, but it takes a combination. One is changing your diet. Another is cleansing your body of the toxic chemicals that are in there. Restoring balance and proper function to the stress glands in your body. Removing nerve damage and mildly exercising. So these can give you a solution not only to diabetes, but to numerous other health problems that you may have checked off on that stress-related survey. So one of the primary reasons many good approaches to health problems fail is simply because they're incomplete. Anybody like to play puzzles? Okay. Do you ever play a puzzle and there's one piece missing and that frustrates you? So lots of times it's not because, again, doctors don't want to help you, but they're not leaving out some of the pieces to the puzzle. Like a splinter also. Anybody ever get a splinter? Okay, you know that if you don't take the whole splinter out, that thing's going to hurt you forever. You got to take the whole thing out. You can't take part of it out. You have to really remove the whole thing. And just giving somebody medication to cover up a problem is not getting rid of the whole answer. Okay, so I give everybody a chance that comes to one of my talks to learn more, because I went over a lot of information for you. I want to give you an opportunity to do something about it. So what I do is I offer everybody a comprehensive consultation in my office at no charge. I have nothing to lose. Come talk to me more about what you're concerned about. We'll figure out whether it's something I could help you with, and it doesn't cost you anything. It may change your life. So I believe that I don't want to have any obstacles in the way. I want to change lives. And if you can come in and just find out what I could possibly help you with, and then implement that, and I'll tell you exactly what the plan would be to implement that, exactly what it would cover, what it would cost. There'd be no surprises, and that first visit is absolutely free. So it's the opportunity to receive free of charge a comprehensive wellness consultation and screening. Okay. And this says, I don't want to convince you of anything. I want you to convince yourself that you're not happy perhaps with how you're feeling. You're not happy with really what the future might reveal, some of the complications of the problems that you already have. Maybe we can improve your health span and your lifespan. I've done it with thousands of patients. Consultation will help us find what you've done to injure your body. Bodies break down because of injury or abuse. You can find out why your health has been lost. We can plan a way to recovery. This will be the most thorough consultation you've ever had. I set aside an hour for this consultation. I don't know, have you ever spent an hour with a doctor just talking about your health? The average visit now is between 7 and 15 minutes. So they're not making enough time to do what I do. They're just not making enough time for it. They're being forced to treat people a certain way. Insurance companies are forcing them to treat people a certain way. You have this much time, you get paid for that. Don't spend any more time with people. Don't teach them why, just tell them what and write them a prescription. That's what they have time for. Isn't that the typical visit? If I'm saying something that isn't accurate, let me know, because I know that that's the typical visit. It's not that way for somebody who's doing the kind of work that I can't do that. I didn't want to do that. I didn't want to become part of that system. I wanted to be part of the system that really helps people become healthier. So the educational visit includes these things, just so you know, when you come to my office, this is what you're going to get. You're going to get a screening test, and I'm going to give you a questionnaire. If you're interested in coming in, I'm going to give you something that you need to fill out before you come. Because I want to know more about you than I know already. I want to be prepared to give you the best advice possible. We do a posture evaluation because that tells me about pain in your body. We test for undetected nerve damage, something that might be hurting you that you don't even know about. We check a diet diary that you fill out for me. We measure your percentage of body fat. Has anybody ever had that done? You know what that is? It's not just weighing you. It's telling you what percentage of your body is actually fat. That tells you how much weight you really, really should lose, ideally. Doesn't mean that you have to, but that's what you really should lose, not weight. Okay? We do a computerized scan of your feet because lots of problems start in the feet. Anybody here have any foot problems? Okay, so most doctors don't even pay attention to your feet unless you complain about it. I know that they're a problem even if you're not complaining about it. We do a consultation reviewing the questionnaire that I would give you, and we talk to you about insurance benefits if you have any, and we talk to you about what the plan covers, what it costs, and you have no surprises. So that's what that one visit would do for you. And you'd learn more than you learned here today about yourself. You'd learn more about what could be done for your own particular problem. If you qualify for your consultation, then the program includes a physician supervised nutritional counseling, exercise advice, eating healthy for life program to limit your need for medication, type 2 diabetes prevention, control, reversal, weight loss. All of that is the plan that I developed for you individually. Supplements as you need them, stress management to tell you how to handle stress for the rest of your life, teaching you about shopping and meal planning. All of that is included in the program if you decide to take it. Okay. Health potential results may include improving your overall health, reducing your weight, improving your blood test results, limiting your need for medication, improving sleep if needed, improving energy, decreasing pain, decreasing comfort. Does anything sound bad there? It's all good. There's really no downside to it. You just have to be willing to do something different. Okay, so these are envelopes that I have here. If you're interested in taking advantage of that free consultation, I will give you one of these envelopes. And you have to fill it out. You have to do a little homework, okay? And you have to send it to me before the appointment. And the appointment is free. I will look over the information before you come in, spend time doing that, totally free, because I think that lots of people out there have the potential to be so much healthier than they are. They just don't know what to do. So the other thing is that I always offer an opportunity for anybody who comes to this. If you know somebody, anybody know somebody else who you think might need something that I'm talking about? Raise your hand. Not, that's okay too. So I give you a health pass for them. So you could invite a friend or you could tell the person that talk that you went to and a friend or a relative, and they're also entitled to a free consultation in my office too. If you want one of those, I give you one of those. So this is a statement that I've lived by. Education alone is powerful, but not as powerful as education with action, which can be life-changing. So have you ever heard of anybody who, went to a really good school or they got a degree in something and they really never used it or didn't really live up to their potential? So education is one thing, but you got to use it. If you don't use what I'm telling you today, it's not going to be worth anything. If you use it, it really could be life-changing. That's what I want you to realize, how much you could change your life by doing something different today than you've been doing. So there's hope. Don't be hopeless. Hopeless is no good. Utilizing strategies which remove the harmful effects of stress, learning how to eat for life and reduce pain naturally, you can reach your ideal weight, live longer and healthier, have less pain, have more energy, sleep better, limit your need for medication and surgery. Everybody needs a coach. Anybody who knows, is there anybody who doesn't know Michael Jordan? Yes, maybe not. You know who Michael Jordan is? Yes. Okay. He considered the greatest basketball player ever. Well, the thing with Michael was he came out of college, great talent, but until he met a great coach, he didn't win any championships. So when he met a great coach, his name was Phil Jackson, he won 6 championships. So I want you to win a championship for your life. I want you to really, really have a coach that can help you be healthy for the rest of your life. But without a good coach, you really don't know what to do. So I'd like to be your coach, or at least give you the opportunity to find out if we're a good fit. Basically, if you decide to use me as a coach, I want to change your life. It's my purpose. Okay. Any questions that you have? Anything that you want to ask me? Take advantage. I'm here. Yeah. Yes. No, we never change anybody's doctor or what that doctor has prescribed for them. It has to be integrated, and it has to be something that you, your doctor, and decide also would be a good idea, but it's not going to be in opposition to what they do at all. It's in addition. Think about it like that. What your doctor isn't giving you, I'm adding something to that and not taking anything away. And we wouldn't do that. My office is near the mall. That's landmark. You know where the mall is? Okay, the one here in Danbury, just off of Kenosha Avenue, very, very close to the mall in Danbury. You know where that is? Yeah. Okay, so it's about, I'd say about 12 minutes from here, somewhere around there. Any other questions? Anything you want to ask me? Anybody who wants to take advantage of that free consultation? Okay, so I give you guys an envelope. In the envelope, it has those things that I mentioned: diet, diarrhea, wellness intake. Take one of these. Okay. And I have options for times for that consultation. So I would say, if you want to come up here and set up a time, you can do it today. And then I would say, I will reserve that time, an hour in my office. After you fill out this consultation, if you get it to me before then, we'll be ready for you. So come on up and we'll. Usually within the first 2 weeks from now. Okay. Well, we'll come up with, okay, we'll come up with something that's good for you. Okay. So the ideal thing is to set up the time. So I set it aside. I try to set aside enough time for everybody that comes into my talks as a time.